standard precautions are in place, and in most instances you're going to have a partner with you that can assist in manually immobilizing this patient's extremity as we stabilize it. A lot of patients will also be self-splinting, and to help the patient do that, we can slide the board underneath the injured extremity, then the patient can hang on to the board. All right, once we have the injury manually immobilized, we're going to check the pulse. Feel that?
Yes.
Feel that?
Yes.
Wiggle your fingertips. Optionally, you can check the skin color, skin temperature, and capillary refill on the fingers as well. Now, in order to properly immobilize this, we want the patient's fingers at the end of the board, and we also want to put the hand into the position of function, which is if you simply relax your hand and hold it to your side, it will form a curved position. So to maintain that curved position, we're going to put either a row of Kerlix or some 4x4s underneath the hand. We're now going to use Kerlix to hold the board in place. We're going to begin with a lock loop around the wrist. And then we're going to run a minimum of 2 passes between the fingers to hold the hand in the position of function. And you can grab the Kerlix on the edges of the board, which will stabilize the Kerlix. And of course, tuck any loose ends. We're now going to take a second row of Kerlix, and we're going to come proximal to the injury site. We're now going to create a lock loop, and then simply wrap the remaining Kerlix around the arm so as to stabilize the arm proximal to the injury. Okay, if you happen to have an open fracture here, what you would want to do is take sterile 4x4 gauze and loosely cover the injury site as well. To further stabilize this injury, we're going to sling and swathe at roughly a slightly elevated angle above 90 degrees at the elbow. So we're going to take one cravat, we're going to take the angle, the 90-degree angle of the cravat, put it at the injured elbow, place it against the patient's body, wrap it up, and we're going to tie a square knot on the side for patient comfort, padding as may be necessary. Tuck any loose ends. Okay, relax your arm. Okay, we're going to come down here. We're going to create a pocket by tying a knot or using a safety pin at the very corner of the cravat. Okay, that looks good. We're now going to take 2 additional cravats, and we're going to swathe this to the body. We want to come right above the forearm with one cravat, tying it here anteriorly in a dead space for patient comfort. All right, you got to be careful because when we're going circumferentially around the chest, we don't want to interfere with the patient's breathing. All right, is that too tight?
No.
Take a second cravat, come around the body, again, being careful not to compromise breathing, tying a square knot here anteriorly. Are either of those too tight?
Nope.
You can still breathe okay?
Yes.
Take a deep breath in. Okay, when everything is done, we're going to go back. We're going to ask the patient to wiggle their fingers. We're going to check capillary refill, skin color and temperature, and in some instances, if you can maybe sneak a little finger down, you can sometimes reassess a pulse distally.